and they said they had the heart. So everything just kind of went from one direction to the other direction.
A life-changing phone call came on Christmas Eve. Meet a longtime nurse who got the most special gift, more time with her family. Good morning. It's Friday. I'm Jessica Lovell, and welcome to the Morning Medical Update. This past Christmas, while so many families gathered to enjoy the holidays, something remarkable was happening right here at the University of Kansas Health System. And as often happens here, it was a matter of life and death. 4 people came through these doors in a single holiday weekend for a heart transplant. The dozens of doctors, nurses, and other support team staff members who cared for these patients, they worked tirelessly through the holidays to do what they always do, save lives. But one of these heart transplant patients had already been here at the health system thousands of times, not as a patient, but as a beloved nurse who worked here for decades.
Would you prefer it in your arm or your belly?
You can do the arm.
Archie Moore is not used to being a patient,
Well then.
but she has spent plenty of time with the patients here at the University of Kansas Health System. For 28 years, this is where Archie worked every day as a nurse before retiring in 2020.
I knew I'd be in good hands. This is the one place I always wanted to come if something dire happened to me.
And dire it was. About a year after retiring, Archie noticed something was wrong with her heart. But looking back, she says the signs had been there for a few years.
Shortness of breath for one. It even got to the point where I could not go up steps.
Life went on like that until she had an episode too frightening to ignore.
Almost like a panic attack.
Except Archie says she couldn't breathe, and she knew.
My heart, it was going into heart failure.
A few weeks later, she says doctors at the University of Kansas Health System placed her on the transplant waiting list. The holidays were strange, so many unknowns. Archie was determined to have a nice Christmas with her family.
I have 13 grandchildren, so it was Christmas Eve, and our tradition is kind of to have a pajama party. And the call came in, and I looked at the number.
They had a heart for Archie, who, of course, felt every joyful emotion you could imagine, along with profound sadness at the same time.
I felt overjoyed for one, and then I kind of went to the other end and felt sad because I knew somebody had died to have this privilege to get this heart. I didn't know the circumstances, but I knew somebody had to pass it along. Definitely out of love for me to be able to receive that at that particular moment.
And on this day, as she prepares to be discharged to go home to her family with her new heart and her new chance at her wonderful life, she has another feeling that Archie says will forever be part of her.
I am forever grateful. Every moment, every day I wake up and open my eyes, I will be forever, ever grateful. And Christmas will never be the same.
And we are so grateful to have Archie joining us this morning alongside her daughter, Tidra. Ladies, thank you so much for being with us, and Archie for sharing your story. Good morning. Here in studio with us is the surgeon who performed Archie's transplant, Dr. Mac Danter. He's the surgical director of cardiac transplant and mechanical circulatory support here at the health system. Good morning.
Morning.
How are you? Good to see Archie, isn't it?
It's really good.
I know that.
It's a great story.
It is a good story, a happy ending. And part of that happy ending was also Jan Caldwell. She's a nurse practitioner on the advanced heart failure team who played a key role in Archie's treatment and her recovery. Good to see you, Jan.
Good morning.
How was it to see that story and to see your friend and patient?
It's wonderful to see how well she's doing.
It really is. It really is. Archie, I want to start with you. So we just hear this amazing story. It's so emotional. You ended up going to the ER in late September before this transplant. But before that, how was your health overall?
Overall, it was steadily declining, and I kind of ignored it for a little bit, but then it started to get really, really serious once I realized I couldn't ambulate up the stairs anymore, and that kind of just got me really thinking something was seriously not going well at that point.
Tidra, before the ER visit, were you noticing your mom's condition getting worse?
Well, slowly declining within the last 5 years. She had slowly just start going down to where she wasn't climbing up the stairs anymore, or we weren't walking through the mall and things of that nature.
Weren't living life the way you used to. Archie described that episode where she couldn't breathe, her heart racing. She goes to the ER and then gets her she gets then transferred here to the University of Kansas Health System. So Jan, when you first met Archie, what condition was she in that you remember?
So I had the pleasure of meeting Archie early on when she first presented to the hospital, and she was significantly decompensated. She was very short of breath. She could not lay back flat, and I knew she was in trouble with her heart. So we were lucky enough that it was over a weekend, and I asked Dr. Vidich, the transplant doctor, to come in her room and take a look at me. He took one look at Archie and said, "You're going upstairs to the ICU." And that's when it all started, the process.
So then kind of dive into that more. What made it clear to you that Archie didn't just have heart failure, but this was advanced heart failure?
So a couple things. Her ejection fraction was 10%, meaning that her pump was just barely squeezing the blood out. And then the fact that she physically could not walk from the hospital bed to the bathroom without being so symptomatic was very obvious. She could not lay flat, and it was clear that she'd been covering those symptoms for a while and just adjusting to them versus realizing what was happening.
So either of you jump in on this, because clearly Archie's in bad shape. So what is the process, and how does the team come together to decide how and when she gets on that transplant list?
So it's a multidisciplinary team that involves, everything from ethicists to the surgeons to the nurses and coordinators that are involved with the process, psychiatry, physical therapy, basically every element that you would want to have involved with someone's sort of comprehensive care is involved with that decision. And then we assess the clinical parameters, we assess the social and psychological parameters, and then basically it's a group committee decision that sort of puts someone on the list, and then the waiting sort of begins.
Yeah.
And it's not like it's a passive process. The whole time through, we're trying to optimize and get people as ready for a big surgery as we can.
Keep them healthy enough for that. Yeah, it's not a name on a list. It's a person and a patient that has to be carefully evaluated as that waiting continues. Tidra, when you learned that your mom has heart failure and now it's so advanced that she needs a transplant, what was going through your mind, or was this something you were expecting?
Well, I just kind of knew that, whatever decision that she made, that I was going to support it. I didn't let emotions get to me because I'm the oldest daughter, so I had to be a little stronger for everyone. But I knew with her being a nurse and being in the medical field for the amount of time that she's been in there, that she was going to make an educational decision on what to do with her own health care.
Well, and heart transplants, they happen 365 days, 24/7. But this happens, she gets this call on Christmas Eve, quite the gift for her and her family. But Dr. Dander, and we know this happens all the time, but it's something interesting to imagine during this holiday. It's time to kind of be quiet and with family, and your teams are here, coming together to pull off all of these transplants all at once. It takes a lot of resources.
Yeah, it does. I mean, it's hard not to get a little bit romantic about heart transplant when you hear these stories, and it's not really lost on anybody that this is what's occurring. But the team is a group of consummate professionals that one of the things that was quite impressive to me was how basically there was never a single, oh, we got to do another one, or we have to do this, or we've been going at this for 30 straight hours or anything like that. It's just, yep, let's just, keep going. So that's kind of special, I think, as well. And when you get a chance to help someone that's given so much to patients as Archie has, it's also kind of it's kind of special.
Yeah, it is. Jan, what are your thoughts on that?
Well, I know historically that nurses are kind of the worst patients.
Why is this?
Well, we take care of everybody else, but we don't take the best care of ourselves, and sometimes we forget to take care of ourselves. So, like I said, when I looked at her and I knew that she was a rehab nurse and had just retired, I thought, she's in trouble.
She's
So,
let this go. Yeah, she needs someone to take care of. It's her turn now.
Yep,
Archie, is that true? Do you feel like you were somebody who just took care of people? You've got kids and grandkids, and do you feel maybe that your health took a back seat?
Yeah, but you kind of, I don't know, be unselfish. I enjoy every moment of it, every moment. And I just kind of ignore myself. Probably wasn't the best thing to do, especially being a nurse. You would think I would know better and recognize all these signs, but I kind of just pushed them back.
Well, and that, yeah, please.
You're not alone too, Archie. I mean, heart failure for the audience is a very insidious process, and it's a very slow burn where you have sort of gradual declines in your functional status that happen over months and sometimes years. So it's difficult sometimes to perceive when the dramatic changes have happened, because it's just a day, maybe I'm just not feeling as good as the day before. So it's not, it really is an insidious process, and we have very many people that present quite late with their heart failure.
Yeah, not like Archie was ignoring some massive sign.
This is just, for people that are watching, it's for to recognize your heart failure symptoms. And just getting old is not, like, you don't get short of breath just because you're older. You need to actually explore that. You know what I mean?
Well, and I don't know how many times we hear on this program, some of the symptoms to all sorts of different ailments or diseases. I feel tired, I feel fatigued. I'm like, I feel that every day. So, how do you know when to come see you? And I'm going to ask you that. How does someone like Archie know when it's gone too far? What are those early signs so people don't end up, in your operating room?
Right. So really just paying attention to your functional status. So if you are, I always ask patients, because some of the other things too, like some valve lesions or other surgical disease that we encounter, basically sometimes, it's not just fair to ask, do you have any symptoms? Because what people tend to do is change their behavior so that they don't elicit these symptoms, or they don't get short of breath when they're doing it. So what I always ask, and for practitioners to ask, is, well, compared to 6 months ago, what can you do? Can you do, and you'll have people say, well, I used to jog, or I used to do this, and now I just sort of go from the couch to the TV to the, to the fridge to the bathroom. And so recognizing that is not a normal process. Just getting older is not, should not be the explanation for why people are having increased symptoms.
And stopping doing the things that you've always done is how some people miss the signs, but those in themselves can be the signs that you're not jogging anymore, you're not getting out anymore to avoid the heavy breathing.
Right, precisely.
Archie, it's been 4 months since the transplant. How are you doing? How are you feeling?
Great. I must say, much, much better. I actually can navigate 16 stairs without passing out at the top. Overall, I can breathe. I can talk. I just feel much better. Not at 100%, but nearly not where I started. No. I'm doing fine. That's cardiac rehab. The treadmill was my biggest fear. I started at 0.1 speed with no inclination, and now I'm up to 15 minutes on that thing. So may not be a lot for some people, but for me, that was a major accomplishment.
Okay.
I was
truth be told,
rehab.
Archie, I don't go over 15 minutes on the treadmill myself, and I'm not running either, so so you're fine. So how important, though, is that cardiac rehab when these patients are trying to get back to that 100%?
It's critical in the post-op. They get out of the hospital and they're coming through their surgical recovery, and going to cardiac rehab is a big piece of that, because in rehab they really push them and they show them how to exercise, and they get they've usually been a little bit debilitated from being sick, and so they get so much of their strength back and their overall, energy, and no longer so deconditioned.
And that's why they need to be good patients. Yeah.
Yes.
Not just before and during, but after for sure.
Yep.
So I want to show the pajama party, because this all happened during Christmas time, and I want to see these grandkids and this big family, Archie and Tidra, of yours, and you wanted to get home. You wanted to be there for many, many more Christmases. Tell us a little bit about the family and how exciting it is to know that you're back with them.
Well, they were very supportive. It took its toll on them. I have 13 and some honorary ones, but it kind of took their toll on them, psychological too. They were kind of like having issues at school. Even the 7-year-old, it just kind of, me being in that hospital was not sitting well with them at all. And this happened the 25th. One grandson's birthday was the 26th, and his prayer was, I didn't die on his birthday. So it kind of took its toll. But that day the call came in, and actually we were headed out the door to the party, but everybody was with the program. We just made a swift turnaround, whoops, we got to go this way now. Nobody grumbled, nobody griped. And like Tidra, I wanted to be strong and not show that breakdown emotion, because I didn't want them to go there. So it went okay, pretty smooth.
So Archie, I know you had mentioned, that you'd had to have some tough conversations. I know you're very deep in your faith, and you'd made peace with whichever way this was going to go while you were waiting for your heart. But you had to have some tough conversations, I think, with your family. Isn't that correct?
Yes, we talked about the fact of me actually dying before I actually went to the hospital, and I was kind of getting my ducks in a row in case that should happen, and kind of just making everybody aware, this is just actually a part of life. If I go, I go. Be happy and remember all the good times, right? That's okay if you need to, but don't just sit there and grieve. Be happy for me, because I'm happy and I know my soul is saved. So I felt comfortable and confident in that fact.
Well, your soul is safe, but you are still here with us and with your family. It's May, so we're celebrating mothers all month long. And Tidra, what's it like knowing that you're going to get to spend another Mother's Day with Mom this year?
Well, I'm happy, because not a lot of people my age are still having their mother with them. So I'm happy she gets to get us another year of her kicking us around. And not only just Mother's Day, it's just like all the holidays mean so much more now.
They sure do.
And she thinks she owns me.
I love
she spent so
it.
much time out of state, so now she's back. She thinks she just owns me. She my mama.
I am, and I'm her favorite.
Oh, okay. So the mom, okay. The mom-daughter relationship is front and center. I love this. Okay, good. So many more years of all of this nonsense. I love that. So Jan, what's it like just seeing and hearing that and just watching them smile and share stories?
I've been so fortunate to see Archie in the transplant clinic after she's left the hospital, and she's moving through her rehab process, and every day I see her, she's better. And she just looks so wonderful, and it's been amazing to see her journey and how well she's come through. and her and her daughter have a very good, close relationship as well.
I remember Jan, she would come in my room and call my name like she actually didn't expect for me to respond. Archie.
Archie, in her gentle way.
Yeah,
Well,
she's
we love having you all back together again. If you have any questions for anyone on our panel today about heart failure, transplants, you can use the chat on YouTube, Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. All right, let's get a Friday check on our COVID count with Dr. Dana Hawkinson. Good morning. How are you?
Hi, good.
Hi.
Yeah, the cases were a little bit better yesterday.
Yeah.
But 28 total, 12 active now, up just a little bit from yesterday's 10 active, but still 0 in the ICU, 0 in the ventilator, so no severe disease right now, which is good.
Okay, thoughts on this headline that we've seen? Doctors in Nevada have noticed a cluster of rare brain infections in children. There were 18 cases in 2022, which is triple the normal amount. Most of the kids actually needed some brain surgery for treatment. No one died, thankfully, but Hawk, what are these brain infections? What are they? And is there any way to figure out why there were so many of these cases?
Yeah, these were, collections of infection inside the skull, so intracranial abscess, basically what they were. The physicians there anecdotally noticed maybe increased numbers that they were seeing. This is not unusual from other things that we have seen as far as people are noticing more. I think certainly it needs to be investigated more. Is there an increase in rates of certain infections or certain conditions, and as to why? Certainly in our practice here at the health system, we work very closely with our neurosurgeon colleagues, and we do see a lot of brain abscesses, but there are many reasons why people can get these infections. And when they looked at the actual bacteria that are causing them, there were a few cases that had the same kind of bacteria, but others had other kinds as well. So I think we need to keep up our surveillance and our investigations of these processes, and if there does look like there does seem to be a true increase, figure out why that is and try to prevent it as well. So this is, again, just one more thing that we are noticing more anecdotally after the pandemic, but there are probably a multitude of reasons why. And it should be noted that these infections that they are talking about, they weren't all the same bacteria, all the same infection, different causes, but I think we still need to investigate further.
All right, Huck, thank you. Any reporters with us today? Let's get to our community questions. Yen wants to know, did doctors gradually reduce the dosage of anti-rejection medication for patients who've undergone heart transplant?
Yes, excuse me. Yes, over time they'll reduce both the doses of the steroids and the also sort of the rate at which we do surveillance with biopsies, and we have other means of monitoring for rejection. But yes, over time they will. It'll depend largely on how effective we've been at getting them into their therapeutic range. But yes, the short answer is yes.
So what is the post-care for someone like Archie in the next months and the years to come?
I think Jan might be able to answer that, because from the surgical standpoint, once we don't follow them nearly as closely as the nurse practitioners do in the community.
Well, so she's kind of already set up on a schedule of her clinic visits, and along with that, we have routine, not only lab tests that help us follow for rejection, but then she'll have her heart cath and biopsies that we also do per protocol. And then usually the farther out we get, the less we have to see them in clinic. But early on, we see them quite frequently to keep an eye on things.
Makes sense. So Paul wants to know, I love this question because I probably have wondered it, but just didn't ask. So Paul's asking it. During a transplant, how long does the body go without a heart in it before the swap is made? Tell us about the swap out.
Well, yeah, so a lot of the transplant procedure is preparation for arrival of the donor organ. And then when the donor organ arrives, we inspect it and see that it's, there's no surgical trauma or congenital abnormality or something like that. And then basically we try and minimize the period of time where we're both on the heart-lung machine, which is the device that provides the circulation and the oxygenation of the blood so that we can perfuse the body throughout the entire procedure. The time between when the heart is out and when we've sewn everything back in and we're reperfusing it is usually around an hour or less. The whole operation can take, some can take a day and a half, but the reality is that it's about an hour where there's no heart in the patient. But throughout that whole process, we're perfusing the heart and using the heart-lung machine to maintain the circulation.
I know you make it sound so routine, but it's very exciting and fascinating to see how this all comes together.
It's no doubt. I mean, the first, 100 years ago when I started this, the first, half dozen you go to put in, you go, there's no way this is going to work. It's been in a bucket for 4 hours, and we, you know what I mean? But they almost all of them usually do.
They take. Question: we talk about LVAD a lot on here. Explain in layman's terms what LVAD is, and then was Archie a candidate for that?
So an LVAD is, the acronym is left ventricular assist device, and what it is in the sort of sense that we use it is a more durable or permanent LVAD is a mechanical pump that sits inside the left ventricle and essentially does what the name says. It assists the ventricle in propelling blood throughout the rest of the body in order to maintain an adequate circulation and keep people out of heart failure. Yes, in the event that there was no sort of reasonable option in terms of Archie getting an organ in an appropriate length of time, or if she had declined, then yes, that would have been a potential option.
All right, I want to get our takeaways today. Jan, what do you want people to take away from this conversation?
Well, I think it's important just to emphasize it's a group effort. We have an amazing team here in our system. We have awesome physicians, we have awesome surgeons, and the whole transplant team itself is very solid. We work hard together, and so glad to have these, wonderful stories that we can tell, but it definitely takes a team effort to make it happen.
About how many people are on that team? I'm just curious.
Oof, a lot.
Yeah, I mean, our meetings will have 15 to 20 people at the meeting, another dozen online the call. A lot of the focus is sometimes on the in-hospital phase, but really how, patients do well long term is by the care that they get from the outpatient group, which is that's all the clinic people, the nurse practitioners like Jan, the people that follow these people. So, I echo what Jan said, that there's no way we're able to do the things here without the team approach. And I'd also just like to say, for people who are out there, pay attention to your symptoms, and what you did 6 months ago. If you can't do those things now, then I just first, don't just chalk it up to I'm a little bit older or these kind of things. I think because really there are options for people now, and we have such a robust team, as Jan said, that there are options for people.
I love what you said, because how many times we say, "Oh, I'm just getting older. Oh, I'm just getting older. Oh, aging sucks." But really, that's not the excuse.
Yeah.
There's help for that. Okay, so Tidra, what do you want folks to take away from your mom's story and your family story?
Just to hug each other a little longer, and remember that tomorrow's not always promised, and that there is a such thing as a miracle.
Yes, they do happen. Archie, what's today's takeaway from your story? What do you want us to send us out with a good message on this Friday?
Well, first of all, I like to, here we go, thank everybody at KU, not only the medical team, everybody, the support system from housekeeper on up, everybody, transporter, everybody was wonderful, supportive, just caring all the way across the board. I have not encountered any bad experiences or relations with no one. And if it happens again and I'm in that dire situation, take me to KU. And I'm just grateful most of all to God for allowing you guys to be an instrument in his work to keep me going. I don't know why. I'm still trying to figure out what my purpose is, but I'm just grateful. And thank you.
We know you are.
Sincerely.
Well, we hear you. A lot more pajama parties in your future. Yes, that's your purpose, is to hang out with them. You got 13 of them. You got a lot to take care of. All right, ladies, thank you so much for being with us today. We appreciate you so much sharing your story. Thanks to all of our guests and, of course, all of our viewers for being with us. Have a great weekend. We'll see you back here Monday at 8. Coming up Monday on the Morning Medical Update. When Doug Lewis showed up at one hospital with a serious stroke, doctors knew the team at the University of Kansas Health System had the best shot at saving his brain. I'm Jessica Lovell on the next Morning Medical Update, the advanced technique that restored blood flow to his head and how doctors discovered a new problem in his heart. Monday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.